A 30-year-old woman with a history of systemic lupus erythematosus, SLE, presents with a recent spontaneous abortion at 10 weeks gestation. She also has a history of a prior deep vein thrombosis. Laboratory tests show prolonged PTT, a positive anticardiolipin antibody, and presence of lupus anticoagulant. Which of the following best explains the laboratory finding of a prolonged PTT in this patient? A. Deficiency of coagulation factor 3. B. Antibody-mediated activation of protein C. C. Inhibition of phospholipid-dependent coagulation assays. D. Increased fibrinolysis. E. Cross-reaction with platelet glycoproteins. Inhibition of phospholipid-dependent coagulation assays. Explanation: the lupus anticoagulant is a misleading name. It paradoxically causes hypercoagulability in vivo, but prolongs the PTT in vitro due to interference with phospholipid reagents used in clotting assays. Why not the others? A. Factor VIII deficiency causes hemophilia A, but is unrelated to lupus anticoagulant. B. Protein C activation leads to anticoagulation, not a prolonged PTT. D. APS is a prothrombotic disorder, not fibrinolytic. E. Antiplatelet antibodies occur in ITP, not in APS-related PTT prolongation. Question 2. A 27-year-old woman is being evaluated for recurrent miscarriages and intermittent leg swelling. She has no known autoimmune diseases. Labs reveal positive anticardiolipin antibodies, lupus anticoagulant, and Beta-2 glycoprotein 1 antibodies. Which of the following is the most appropriate diagnosis? A. Systemic lupus erythematosus. B. Heparin-induced thrombocytopenia. C. Antiphospholipid antibody syndrome. D. Thrombotic thrombocytopenic purpura. E. Immune thrombocytopenic purpura. Correct answer C. Antiphospholipid antibody syndrome. Explanation: antiphospholipid syndrome, APS, is diagnosed by clinical features, e.g., thrombosis, pregnancy morbidity, plus lab criteria such as anticardiolipin antibodies, lupus anticoagulant, or anti-Beta-2 glycoprotein 1. Why not the others? A. SLE may coexist with APS, but this patient lacks systemic lupus features. B. HIT involves thrombocytopenia and recent heparin use. D. TTP presents with thrombocytopenia, MACA, fever, renal, and neurologic signs. E. ITP presents with isolated thrombocytopenia, not thrombosis or miscarriage. Would you